Postural Restoration Certified, or PRC, is a credentialing program offered through the Postural Restoration Institute, available for physical therapists, physical therapist assistants, occupational therapists, and chiropractors. This program began in 2004 and has continued on since, and we have over 200 PRC practitioners currently across the world. I want to take the opportunity this afternoon to go through the PRC application, which I have printed out here in front of me. It's available on our website, and walk through this application a little bit with you, outline some tips or some examples, and some information to consider as you put together your application for PRC credentialing. So the first steps is making sure that you fit one of those categories: physical therapy assistant, chiropractor, occupational therapist, and you will supply your licensure information from your state, as well as some demographic information at the beginning of the application. The next part of the application is listing the PRI courses which you have taken to this point. For PRC, the required courses are myokinematic restoration, postural restoration, pelvis restoration, and advanced integration. The advanced integration course can be taken right before testing, which is offered in December, the first week of December every year, and then testing is the 2 days following the advanced integration course. So if you're planning on taking advanced integration right before testing, you would just indicate that on your application. The next part of the application is the clinical and academic evidence. And the first part is 3 anonymous case studies. And these should be case studies, real life case studies that you have used and applied PRI concepts within your clinical practice. We want them to be anonymous, and we want you to take the opportunity to use these case studies to provide the review committee your understanding of the PRI concepts in clinical practice. I would recommend choosing case studies that show some variety in your practice, so that show demonstration and use of myokinematic restoration, postural restoration, and pelvis restoration concepts. Therefore, selecting, for example, a case study on low back pain, maybe a case study on shoulder or neck pain, and maybe a case study on hip pain or knee pain, would show some variety throughout those 3 courses. We also want to make sure that you are demonstrating use of all of the PRI objective tests. That's not to say that you have to perform every objective test at every visit. We all know that we're busy and sometimes you don't have time to go through the entire list of PRI objective tests. However, we want to make sure that you get enough information from your objective test to give your rationale for your treatment or your intervention program and the progression throughout their patient care. Therefore, please don't forget to use PRI functional tests to help guide your treatment plan, such as Huruska adduction lift test, Huruska abduction lift test, functional squat tests. And again, just making sure that throughout the 3 case studies, you're showing use of pelvis restoration, myokinematic restoration, and postural restoration assessment, subjective tests, as well as techniques, non-manual and manual techniques. All of this information helps the reviewers determine whether or not they feel that you're ready for PRC testing. And that's the entire point of this PRC application. The next part of, in addition to those 3 case studies, please feel free to submit any in-services that you have given to colleagues, those in your community that include PRI instruction or training, as well as any programs you put together. If you contribute to a running program locally, or if you've typed up recommendations for office sitting suggestions, for example, those are just examples. Anything you put together that would help demonstrate your use and knowledge of PRI concepts is helpful to submit in this section. The next section is 3 favorite PRI non-manual techniques and why. This is outlined pretty well in this description here on this application, but we really just want you to pick your 3 favorite activities. Again, it's helpful to choose some variety, so choosing all supine 90-90 positions for all 3 of your techniques isn't going to be helpful in demonstrating to the review committee your thorough understanding of all of the PRI kind of concepts. So consider showing some variety with this. Maybe select an integration technique, maybe a myokinematic restoration technique, and maybe a postural or pelvis restoration technique. And in this description, usually about 1 to 2 pages of written content, we want you to consider things such as what's the purpose of the technique? What's the likely outcome of the technique? What techniques could you use before or even after this technique? So if they can't do this technique, which techniques would you consider doing so that they can eventually do this technique? What cues do you find helpful with this patient? If you've modified the technique in any way that you found helpful, what was that? And why did you find it helpful to modify the technique? And then what types of patients or objective findings do you find this technique appropriate for? And then the next part is 3 favorite PRI manual techniques. And this is very similar to that non-manual techniques. The manual techniques we want you to consider choosing are from our postural respiration course, as that is the bulk of our manual techniques. And that is the manual techniques that you will be tested upon in PRC testing in December. So just for example, the left AIC technique, right subclavius, right superior T4, left pectoralis, right intercostal, infraclavicular pump. Those are just some examples. And the manual techniques DVD, which we offer for purchase on our website, goes through all of the manual techniques. Again, those were the most common ones that you learned in the postural respiration course, but you are welcome to, if you find yourself using and have a favorite from that DVD that isn't one of the ones I just listed off, you can definitely submit that and your explanation. Again, 1 to 2 pages in length, describing and explaining that technique and answering the questions that are included on this application. Part 3 of the application is our critical research review. And this is where you will select 5 articles. Again, variety is always helpful. So, selecting 5 articles all on diaphragm function isn't going to be as helpful to the review committee as selecting a wide variety of topics and demonstrating your ability to discuss the articles and critically review them with a PRI kind of lens over your eyes in a written description. And that's kind of the purpose of this section. So we listed out several journals that we frequently find articles from and recommend, but you're welcome to browse the internet, search libraries, and find any articles that are supportive of PRI in this section, and then break them apart. Highlight what is supportive of PRI. What could have they done different that would make this more supportive of PRI? What are the non-supportive parts of the article related to PRI? So really just your ability to integrate and discuss the concepts of PRI within the literature review is what we're looking for on this section. Part 4 is the final part of this application. And that's where we want you to share your advocacy of PRI. We want to know your story. Where did you come from? How did you learn about PRI? Who's been your mentors? What type of practice are you practicing in now? What's your future goals with PRI, without PRI? Are you a CI instructor for students coming to your clinic? Do you teach part-time at a local university or college? Anything and everything that we want the reviewers and the testers to know about you. So we just want you in this section to kind of share your story, what you're doing, where you're going, and what you hope your future to be. So kind of to wrap this up, I'm hopeful that this little video was helpful in giving you some further explanation on what we're looking for in this application. But to wrap it up with the key kind of points, the more thorough that you can be in this application, the better. Again, the review committee is going to use this application to determine whether they feel that you're ready to attend and complete PRC testing in December. Make sure that you are using the PRI objective tests to provide rationale for your treatment or your intervention. So providing a description behind each technique, why you selected that technique, what objective test indicated that you may need this technique or this muscle facilitated or inhibited, for example. Variety, that was a big keyword that I spoke of throughout this video. The more you can show variety of your understanding of myokinematic restoration, pelvis restoration, and postural restoration, the better the reviewers are going to be able to grasp your understanding of these concepts and your preparation and readiness for testing. And then lastly, at the end of your case studies or even throughout your application, feel free to reflect, especially on the case study section. Maybe this is a case study from 3 years ago and you've taken several more PRI courses, some secondary courses, some affiliate courses, and as you look back at your case study and what you did with that patient, you think, man, I wish I wouldn't have done that. I wish I would have considered doing this. Reflect on that. At the end of the case study, feel free to reflect on what you might do differently now and why, based on what you know now that you didn't know then. And finally, although this application process is looking at your understanding of the concepts from those 3 primary courses and advanced integration, if you've taken that, feel free to include discussion, examples, inclusion of other PRI courses, such as impingement and instability, cervical revolution, cranial resolution, the affiliate courses, PRI vision coursework, any of the courses that you put together. We really want to see the well-rounded you throughout this application and your ability to integrate this in your practice. So if you have any other questions after watching this video, please feel free to contact me, shoot me an email, give me a call. I'm here to help with any of your questions that you have related to PRC credentialing. Thanks and have a great day.